Nursing assistants provide care for individuals with mental health disorders in many settings. According to the National Alliance on Mental Illness, NAMI, approximately 1 in 5 adults in the United States experiences some type of mental health disorder. In the United States, this means that over 43 million people experience a mental health disorder within any given year. Among individuals who experience a mental health disorder, 9.8 million experience a severe mental health disorder, meaning it dramatically interferes or limits their ability to function in everyday life. However, of all the adults in the United States with a mental health disorder, research shows that only 41 received mental health services in the past year. And for those diagnosed with a severe mental health disorder, only 63 received treatment or services. These numbers demonstrate the need to identify and provide effective treatment to individuals living with these disorders. Just as there are various physical illnesses with varying degrees of severity, there are also various mental health illnesses with varying degrees of severity. Symptoms of mental health disorders can often be managed with medications, in a similar way that physical illnesses like diabetes are managed with insulin and other medications. By helping individuals with mental health disorders manage their medications and attend psychotherapy and/or counseling sessions, caregivers can help individuals with mental health disorders stabilize their emotions and behaviors and reach their greatest potential in their life. Being aware of common mental health disorders will allow you, as a caregiver, to understand what the person is experiencing and how to help them meet their needs in the best possible way. While every case is different, it is important to be aware of how individuals with mental health disorders may present themselves and start thinking about how you will help manage related symptoms and behaviors. There are several categories of mental health disorders diagnosed by mental health providers such as a psychiatrist, psychologist, or advanced practice nurse practitioner. This section will further describe these common mental health disorders: anxiety disorders, psychotic disorders, bipolar disorder, depressive disorders, trauma disorders, personality disorders, substance use disorder,